Every year during fall when winter, a lot of patients and we as physicians struggle to differentiate whether it's a common cold versus flu. Both of them are respiratory illnesses, but unfortunately both of them have very different consequences. Common cold is caused by a rhinovirus and influenza is caused by influenza virus. The way the both diseases manifest are on a spectrum. Both of them have similar symptoms, but onset, severity, duration is very different. And that's how we can differentiate between a common cold and influenza or flu. Influenza by nature is a severe disease. If you're elderly, have chronic medical problems, or have any immune disorder, you are at high risk to develop complications from influenza or flu, whereas you may weather common cold without any medical problems. What we see every day is that patients fail to ask for help at the appropriate time and can lead to complications. So I will provide you a guideline based on symptoms. Don't go by absolutes, but this is a general guide, and I am very sure you will be able to make a better informed decision. By the end of this video, I was able to guide you to have a framework to differentiate between common cold and flu. I will consider I did my job. First is the onset. If you develop symptoms and you're feeling very sick, chances are it is flu or influenza. If it is coming on you slowly, insidiously, and it's not hitting you right away with high grade fever, chills, aches and pains, and headache, chances are it is common cold. Second differentiating feature is the fever. If you develop high grade fevers, usually it is flu. But if you have just feeling achy or little feverish, probably is common cold. Muscle pains are very severe in influenza and very mild in common cold. Nasal congestion and runny nose and sneezing is a hallmark of common cold. It rarely happens with influenza. Sore throat is very common with common cold and rare or sometimes with influenza. Chills are very rare with common cold. If you are having chills, chances are it's influenza. Headaches are very common with influenza and very rare with common cold. Why it is important to differentiate? Because common cold rarely give you any complications. Even with a weaker immune system, you will weather through. The nature of the symptom is usually mild with common cold. With influenza, you could develop pneumonia, myocarditis, encephalitis, respiratory failure, and sepsis. Especially in elderly patients, we see every day that they ignore the symptoms, end up in the hospital with COPD exacerbation, pneumonia, bronchitis, and leading to complications. So the message is that if you have chronic medical problems, seek help early because your physician is more trained to differentiate between these nuances and help you. Common cold mostly give you self-limiting sinus infection, inner ear infection. How we diagnose these two conditions? Common cold is primarily a clinical diagnosis, whereas for flu we have a rapid test and we could check you out quickly. There are PCR tests for the flu which we could send it to the lab and get it done. These days now there are combo kits because it can check you for flu, cold, and some kits have seen for RSV too. Treatment for both of them is supportive initially, meaning control your symptoms with the Tylenol, keep yourself hydrated, eat properly, rest properly, and there has been some studies using zinc early to boost up your immunity. The evidence is mild. It's not a very strong evidence that it should be recommended as a treatment, but if you have zinc, taking will possibly help you, but it's not the standard of care that you need to take it. But there is a lot of literature which are coming, and the reason I brought this zinc issue is because I have a lot of patients who are continuously asking me about whether they should take a zinc or not. And the evidence, as I said, there is a positive trend, but I don't believe it is strong enough to recommend as treatment. Whereas in case of influenza or flu, we have very good and very effective antiviral medication, which is Tamiflu, which if taken early in the course can prevent all the complications. If taken early in the course of the treatment can prevent complications. Further, how can we prevent? If you have any of the respiratory illnesses, you should use universal precautions. Mask it up, wash your hands, cover your mouth when you cough or sneeze, and stay away from vulnerable population. If you have elderly at home or you're exposed to people who are at high risk, you should do that. Flu vaccine, in spite of all the negativity, resistance which we see from everyone and especially vulnerable population, continue to be only proven source to prevent this disease. Taking yearly flu shots is very helpful, and if you are senior, you should take senior flu shot. And the senior flu shot, you have a high dose of the virus, or they add adjuvants to make sure your immune system is triggered properly and you are preventing yourself or setting yourself for success. Lifestyle and immunity boosters like eating properly, resting, sleeping, managing your stress will always help, and it helps you with every disease. What are the red flag signs? If you are short of breath, having chest pain, you're getting mixed up and confused, and fever is very high and you're getting weaker and tired, that is clearly time to ask for help. My recommendation is that do not wait. If in doubt, don't treat these respiratory infections as innocuous, especially if you are feeling very sick, high-grade fever, you're short of breath, and you're having a lot of aches and pains, plus you have all the chronic medical problems or respiratory problem which will put you at high risk. Don't use anecdotal home remedies and try to treat yourself from social media. If you have risk factor, seek help. I hope this video will help you to understand the difference between common cold and flu. Highlights are onset of symptoms, severity of symptoms, and certain things which should indicate flu are high-grade fever, lot of aches and pains, severe headache, no sore throat, minimal cough and minimal expectoration, no sneezing, and risk factors. My name is Dr. Kundlas, and I will see you in next video. Thank you. Like, share, and subscribe to our channel Kundlas MD.